everybody, Dr. Ahles here. In this short video, we're going to talk about the two kinds of diabetes, which is one of the major diseases that can impact the pancreas. When we talk about diabetes, both types of diabetes have to do with problems with insulin. Remember that pancreatic beta cells secreted insulin in response to high blood sugar levels. So when a person has diabetes, either their body's not making much insulin, or the insulin that they are making isn't very active, or in other words, their body's not responding to it. So when we talk about the two types of diabetes, type 1 diabetes is the type of diabetes that's caused by low levels of insulin secretion. In other words, the pancreas isn't spitting out the insulin that it normally would. In type 2 diabetes, the pancreas continues to spit out insulin. In fact, it might spit out extra insulin. But the problem in type 2 diabetes is that the cells don't respond to that insulin. When we look at these two types of diabetes, what causes them is very different. Type 1 diabetes is an autoimmune disease, meaning the body's own immune system starts to attack itself. In this case, it's attacking those pancreatic beta cells. This autoimmune attack is typically triggered by a genetic mutation, so the immune system incorrectly responds to those beta cells. It thinks that they're foreign, even though they're not. Type 1 diabetes is the type of diabetes that typically is seen developing very rapidly, either in a child or in adolescence. So if you know someone who's very young who is taking insulin or checking their blood sugar, most likely they're suffering from type 1 diabetes, the genetic form that is an autoimmunity problem. Type 2 diabetes is not about an autoimmune attack or genetics. In general, this is a lifestyle-related disorder. So throughout a person's lifestyle, if they have a diet that's very high in sugars or refined starches, their body gets tired of hearing the insulin message. It stops responding when high levels of sugar are detected in the bloodstream. So this disorder, type 2 diabetes, is the one that when you see ads on TV about diabetes, it's probably talking about this one. This is the form of diabetes that develops slowly and typically in adulthood because, like I mentioned, this is lifestyle related. Over time, the body's cells stop listening to insulin. That's problematic when we need to get our blood sugar levels to go back down to normal. When we talk about the symptoms of diabetes, and I'll mention because it's up here, the type of diabetes we're talking about is technically called diabetes mellitus. Diabetes mellitus, we have this extremely high blood sugar level. When we think of the symptoms that are characteristic of either type 1 or type 2 diabetes, they're all caused by issues with high levels of glucose in the bloodstream. The body's cells aren't taking in the glucose. It's not dropping like it should. So there are several different signs that show a patient might have diabetes. The top 3 that we see here on the list are kind of the hallmark symptoms for a patient. So one of those symptoms is frequent urination. With that frequent urination comes extreme thirst, needing to drink more water to offset the water loss, and finally being hungry all the time. Let's look over at how diabetes can lead to these kinds of symptoms. So at the top of my chart over here, I have a note that says that the level of insulin in the body has dropped, whether that's in type 1 diabetes because the pancreas can't make it anymore, or whether in type 2 diabetes it's a drop in functional insulin. The body's not listening. First thing that happens, or one of the biggest things that's going to happen when I don't have a high level of insulin, is all of my body tissues are not going to take glucose in. Remember, that's the job of insulin, to tell those cells to take in glucose. If the body's tissues and cells are not taking in glucose from the bloodstream, the level of glucose in the blood goes up. This is that term hyperglycemia, too much sugar in the bloodstream. With all of that sugar in the bloodstream, as the body goes through the process of creating urine, there's so much sugar that it has to secrete some. There is not normally glucose in your urine. If we see glucose in the urine, this is called glycosuria. Glycosuria, sugar in the urine. When we have high levels of sugar in the urine, we end up doing osmosis. Osmosis is where water moves from a place where there's not a lot of sugar to a place where there is a lot of sugar. If there's a lot of sugar in the urine, that water will leave the bloodstream and go to the urine to dilute it, to get it not to be so concentrated. By all of that water moving into the urine, a person's urine output skyrockets. There's so much water in there that they constantly need to empty their bladder to try to flush out that sugar and flush out that water. But as we're losing all of that water, our body says, wait a minute, I'm dehydrated. And suddenly we feel thirsty all the time. So the two symptoms we see along this track are the increased urine output because there's glucose in the urine caused by my tissues not taking it in. As we increase the urine output, we also become excessively thirsty. Now, I'll mention it's not just the fact that the cells aren't taking in the glucose that leads blood sugar to be high. It's also the fact that if I don't have this insulin message, the liver assumes that it should be breaking down its stored sugar to release that glucose into the bloodstream. So not only are we not taking in glucose, we're also putting more glucose into the blood. And while all of that's happening, our skeletal muscles are also not taking in glucose. Instead, they're starting to break down proteins. Because if they break down their proteins, they can send those amino acids to the liver, who can turn them into sugar. And once the liver makes them into sugar, that goes into the bloodstream as well. So, two of these symptoms, the excessive urination and the excessive thirst, can be explained by the fact that the blood sugar is excessively high. Make sure we know the 3 ways that we end up with excessively high blood sugar. The other cardinal symptom that we're going to look at now is the symptom of hunger. Why are these patients constantly hungry? Well, when I don't have insulin, like we mentioned already, my skeletal muscle starts to break itself down. When it breaks itself down, that is creating sugar for the system. But it also sends a message to the body, my protein levels are getting depleted. That makes a person hungry. And at the same time, while a skeletal muscle is breaking itself down to make sugar, our adipocytes, our fat cells that store energy, are also breaking themselves down to release that energy into the body. As we break down fat, as we break down proteins, all of this triggers the increased appetite in a patient. What we see down here at the bottom are a few other common symptoms with diabetes mellitus. These symptoms typically come back to issues with too much blood sugar. So tingling in the hands and blurry vision, both of these are effects that we see happening because neurons, which are very sensitive types of cells, are malfunctioning because of the excess glucose. We also see weight loss because, as we mentioned, if insulin levels are low, that's going to cause the body to start breaking down any energy stores it has. So big picture, when we think about diabetes, we want to know the difference between type 1 and type 2, what causes them, when did they develop, that kind of stuff. The second thing we want to know about these types of diabetes, what are the symptoms that patients usually experience, and like we talked through here on the chart, why do we see those symptoms, all relating back to this problem with insulin? If you know those things, you're in good shape to understand how diabetes works.